Have something going on down there and wondering if you might have herpes? Many men and women have new genital symptoms and they're wondering, do I have herpes? If this is you, you're probably having a lot of anxiety right now and scouring the internet trying to figure out whether you need to make a doctor's appointment. I'm here to help. Today, we're going to go over 12 common conditions and help you differentiate between those conditions and herpes. It's important to note that the only way to diagnose genital herpes is by going to a healthcare provider, having them collect a swab, and sending that swab to a lab. It cannot be diagnosed based on symptoms, visually, or by a blood test. So if you think you might have herpes, definitely get a doctor's appointment ASAP. First and foremost, let's talk about the symptoms of herpes so you have a little bit of a better idea what you're looking for. We're going to talk both about genital herpes and oral herpes, which is also known as cold sores. If you want to learn more about herpes, make sure to like this video and subscribe to my channel. I have a whole video about herpes that goes very in depth about how it's contracted, how it's tested, and how it's treated. Genital herpes has two types of outbreaks. There is the primary outbreak, and then everything else is called a recurrent outbreak. Primary outbreaks have significant symptoms. Almost always, primary outbreaks come along with multiple sores on the vulva, in the vagina, on the penis, or around the anus. The sores are super painful, and they often start out looking like blisters and then become open sores. There may be swelling around where the sores are, but there's never swelling directly underneath the sores. The other symptoms are often pain with urination, tailbone pain, fever, flu-like symptoms, chills, and sometimes pain that runs along one or both legs. These symptoms with a primary outbreak typically last around 10 to 20 days, and they always resolve on their own. A recurrent outbreak typically has 1 to 3 sores, and they're going to be around the same area where you got your primary outbreak. They are painful, but typically not quite as painful as the primary outbreak. Recurrent outbreaks don't come along with all of those other symptoms, and they usually only last for a few days before the sores resolve on their own. For your reference, this is what herpes typically looks like. So how do you know if it's herpes or some other condition? A lot of other conditions have similarities to the herpes virus, but they don't have all the same symptoms as herpes. The symptoms can often be confusing, so let's talk about them. Number 1, is it herpes or did I just cut myself shaving? I actually diagnose a lot of women with genital herpes when they tell me they think they just cut themselves shaving. It can be really confusing because they're both small areas on the vulva that are open and very painful. If you're questioning, do I have herpes or did I just cut myself shaving? Ask yourself, did I have primary outbreak symptoms like was described earlier in the video? If not, you probably cut yourself shaving. If so, it's probably herpes. Number 2, is it herpes or is it a yeast infection? Typical yeast infection symptoms are pain inside the vagina, on the vulva, swelling, itching, and sometimes a very thick white discharge. Herpes can cause pain inside the vagina and on the vulva, but it never comes along with discharge. Number 3, is it herpes or is it bacterial vaginosis? The hallmark symptom of BV is a fishy odor. It can also come along with vulvar pain, vaginal pain, a watery discharge, and sometimes some bleeding abnormalities. Herpes can cause pain, but never causes discharge and never causes an odor. Number 4, is it herpes or is it folliculitis? Folliculitis is an inflammation of the hair follicles, and this can happen in the pubic region. It often looks rash-like or red, and sometimes it can look like small pimples. It typically involves a good amount of area in the pubic area, and with folliculitis, you're often going to get these little pimples right around the base of the hair follicles. Herpes lesions are often located in more mucous membrane areas, so along the labia or inside the vagina or on the penis. Herpes lesions will never have a correlation with a hair shaft. Number 5, is it herpes or is it an ingrown hair? Ingrown hairs can be very painful, and they usually start out as a very red area on your pubic area, and they grow to be rather swollen and then sometimes can come to a head that looks like a pimple and start draining. Remember, with a primary herpes outbreak, you're going to have multiple lesions. So with an ingrown hair only being one area of redness, it's unlikely herpes. Herpes lesions are also flat against the skin, whereas ingrown hairs are usually swollen and red. Number 6, is it herpes or is it a cyst? Women often get vulvar cysts, and they often happen around the labia, the lips of the vagina, or sometimes around the perineum. They range from small and painless to very large and painful. There are many types of vulvar cysts, but the commonality amongst all of them is that they are always filled with some sort of fluid. Some of them, the fluid is kind of firm and not very easily expressed, and some of them are filled with very liquidy fluid. They can be painful, but they're not blisters and open sores like herpes lesions. And remember, a primary outbreak has multiple lesions, and a cyst is just one. Number 7, is it herpes or is it a UTI? As I mentioned before, during a primary outbreak, you can often have symptoms that feel like a UTI. But the difference is a UTI is just going to continue to have urinary symptoms. Whereas with herpes, you're going to have maybe the urinary symptoms first, but then you're going to start having lesions. However, you could have both a UTI and herpes. So if you think you might have one or both of these, make sure to go get tested. Number 8, is it herpes or did I just have a cut inside of my vagina? Herpes can both be outside the vagina on the vulva and inside the vagina. And the problem with herpes inside the vagina is there aren't lesions that you can easily see to tell whether or not it's herpes. But if you're having pain inside your vagina and you think it could be a cut, ask yourself, did I feel it happen? Most cuts inside the vagina happen during an act of intercourse, and you typically feel it when it happens. You may also have bleeding alongside it or after the act of intercourse. Herpes typically occurs several days after an act of intercourse and doesn't occur during intercourse when you contract it. Number 9, is it herpes or is it just vaginal dryness? For those of you who are perimenopausal or postmenopausal, you know that vaginal dryness is a thing. And it can make intercourse painful both during intercourse and after intercourse. Herpes can cause pain during intercourse, but vaginal dryness happens during every act of intercourse, whereas herpes only causes pain when you actually have an active lesion. Outbreaks from herpes for some of the viruses can happen up to 4 to 6 times a year. However, vaginal dryness is going to cause pain every time, and herpes maybe only a few times a year. So if you're having pain every time, it's probably vaginal dryness and not herpes. Number 10, is it herpes or is it gonorrhea or chlamydia? Gonorrhea and chlamydia oftentimes don't have symptoms, but when they do, there's typically vaginal or penile discharge, maybe some urinary symptoms, and maybe it will cause you to bleed in between your periods. Gonorrhea and chlamydia never come along with sores, and herpes always comes along with sores. Number 11, is it herpes or is it syphilis? Syphilis and herpes can both come along with sores near your genitals. The difference with syphilis is when you initially have symptoms, the sores are firm, round, small, and painless. Only when syphilis progresses do you actually have open sores that are painful. The difference is syphilis always comes with a rash near the sores, and it can also have a rash on your body, and especially on the palms of your hands and the soles of your feet. Herpes never has a rash associated with it. It's just the sores. Lastly, is it herpes or is it a canker sore? This one's about oral herpes or cold sores. Canker sores happen inside the mouth, so they can be on your gums, your inner lips, the roof of your mouth, or your tongue. Cold sores are always outside, so they're on your outer lips and sometimes kind of around the lips or underneath your nose. Ultimately, if you are questioning, is it herpes or is it ... The only way to truly find out is if you make an appointment with your healthcare provider and get tested. If your healthcare provider is at all worried that it's herpes, they're going to swab that sore and send it to the lab to tell you whether or not it's actually herpes. It's really important if you think you might have herpes to go get tested immediately because the sores will resolve on their own. And if there are no longer sores, there's nothing your doctor can test you for. And as the sores get closer to resolving, they sometimes will give you a false negative result on a swab. Again, a blood test cannot tell you whether or not you have herpes. And if you want to learn more about herpes, syphilis, gonorrhea, chlamydia, make sure to check out my other videos. If you have questions about herpes or any of these other conditions, make sure to comment below. And remember, like this video, subscribe to my channel, and stay healthy, everybody.